Stroke, also called cerebral vascular attacks or CVAs, is a disruption in the supply of normal oxygenated blood to a portion of the brain. According to the CDC, 1 in 6 deaths in the United States is due to stroke. 87% of strokes are ischemic, with clots or plaque buildup blocking the flow of oxygen-rich blood in a cerebral artery. The remaining 13% are hemorrhagic, in which a blood vessel bursts or leaks, causing bleeding within the skull. Let's look at how we can quickly identify the signs and symptoms of a stroke. An easy mnemonic to remember how to assess for the signs and symptoms of stroke is FAST. Starting with F, which stands for face, ask the client or patient to smile. Notice any drooping on one side of the face. One-sided paralysis or hemiparalysis is indicative of stroke or stroke-like symptoms.
A. A is for arms. Ask the person to raise both arms. Does one arm drift downward, or is one arm unable to rise?
S stands for speech. Ask the client to speak, repeating the phrase, "The sun shines in Cincinnati," or something similar, which requires a lot of articulation within the mouth. The inability to process speech, develop speech, repeat speech, or speaking with a new onset slur is also indicative of stroke or stroke-like symptoms.
T. T is for time, and the fourth and newest indicator of stroke, the tongue. Ask the patient to stick out their tongue. If the tongue is crooked, or if it goes to one side or the other, that is also an indication of stroke. If you observe any of these signs, call 911 or emergency medical help immediately, as time is of the essence to maximize preservation of motor function and survival. There are several relevant and current scoring systems being used to evaluate the stroke population. Among them are the NIH, Cincinnati, and Los Angeles stroke scales. Consult your individual facility to determine which scale they utilize. These scales are essentially standardized models which assign a numeric value based on factors that increase stroke risk, such as age, health conditions, and motor function, and other screening criteria.